name is Ken Hekman. Welcome to this course entitled 4 Essential Disciplines, a training guide for healthcare leaders worldwide. My colleague, Quinton Friesen, and I are leading you through 15 modules to help you improve your knowledge, skills, and attitudes as a healthcare leader. This is Module 13 of 15. Welcome back. As I have worked with healthcare leaders in more than 30 countries around the world, I find that they have a high level of curiosity about leadership, management, and sustainability. Very few healthcare leaders want to learn more about how to improve the service at their facilities. But my observations from touring hospitals, clinics, and other healthcare organizations made it very clear to me that the opportunity to improve service was significant. Excellent service offers many advantages, as we will see in this module.
We will examine the discipline of service by looking at 4 functions. This module will address preparing and training for good service. The next module will discuss confirming and improving services in healthcare organizations. Let's examine our learning objectives. Participants will learn how market expectations impact healthcare organizations, outline standards for service excellence, apply market expectations to facilities, equipment, staffing levels, and staff qualifications, discern staff training needs in the healthcare organization, and techniques for effective skill development, and resolve service issues in real time at all levels.
A discussion about service needs to begin with a discussion about market expectations. Why does service matter for healthcare leaders and managers? There are several good reasons to pay attention to service. First, medical care is a very personal human service by its very nature. Physicians may rely on imaging and laboratory technology to create a diagnosis and on surgical technology for treatments, but these tools are designed only to assist physicians in building a therapeutic relationship with each patient. Each relationship is uniquely personal. Successful outcomes depend as much on the doctor-patient trust relationship as they do on the physician's medical skills and competencies. Second, patients judge the quality of care they receive on the basis of the service they experience. Patients and their families don't have the knowledge to judge medical quality the way physicians do, so they gauge the quality of care on the basis of how well they were treated by physicians and by those who work with physicians. Good service is perceived to mean good quality of care. Poor service is likely to be perceived as poor quality of care.
Third, providing good service costs very little and may actually reduce operating costs by avoiding equipment failures, facility repairs, and time-consuming conflict resolution efforts. Fourth, good service can be a distinguishing strategy for healthcare organizations in competitive markets. Growth depends on having a good reputation, but we also know that bad news travels faster than good news. When patients have a negative service experience, they are likely to complain about it with their family and friends, which in turn hurts the reputation of the hospital or clinic. People expect good service. They are less likely to share compliments than complaints.
So how do we learn about what good service looks like? We learn about good service by being treated well when we go shopping. Companies in every industry around the world develop reputations on the basis of their daily interactions with their customers like us. We develop loyalties toward certain companies based on their friendliness, how well we feel respected, how easy they are to do business with, their low prices, or a variety of other qualities. The bottom line is that we are happy to recommend them to others, and the reasons we recommend them help us understand the elements of excellent service.
Those elements of excellent service are sometimes referred to as service standards. They represent much more than simply the absence of complaints. An organization that provides excellent service makes sure that everyone feels respected and heard. In healthcare, this means that physicians and nurses need to listen carefully, without interruption, to be able to understand and respond to each patient's unique needs and desires. Excellent service also means attending to details. All the elements of excellent service are part of the therapeutic experience for patients and their families.
So far, we have described service as though it is a human quality only, that it relates to behavior of healthcare workers. But healthcare leaders and managers have responsibilities that go beyond human behavior. Excellent service principles also apply to maintaining healthcare facilities and equipment in a clean and safe condition. Managers can demonstrate respect for patients and families by providing clear directions throughout the facility and assisting those who need help to find where they need to go. This picture tells a story. I found these broken monitoring devices in an intensive care unit at a hospital in a resource-challenged country. 9 of the 10 beds in the intensive care unit could not be used because the equipment had not been maintained properly. Services to vulnerable patients were disrupted, and the hospital lost much-needed revenues because of these broken monitoring devices. Hospital leaders and managers need to make sure that excellent service extends beyond staff training to include clean and safe facilities and equipment.
Healthcare leaders and managers also impact the organization's reputation for service by assuring that there are enough staff to adequately meet the needs in each department, that the staff is qualified to do their jobs, and that they are continuously improving their skills through training. Service excellence begins with an attitude, but it also requires organizational development from healthcare leaders and managers to build a culture around service standards, behavioral expectations, and systems for maintaining facilities, equipment, and staffing levels.
Training clearly plays a key role in service excellence. A lab technician, for example, must present specific educational qualifications to perform their technical duties. But that technical training may not be enough to assure that they understand how to perform their tasks with an attitude for excellent service. If they perform their technical functions competently, but carry an attitude of disrespect or act in an angry manner with coworkers, they can sow seeds of discontent in their department, causing other staff to avoid interacting with them. In some cases, important lab results may be miscommunicated or delivered late because coworkers might avoid an unpleasant encounter with the lab tech. In situations like this, poor service attitudes can impact the quality of care for patients.
You can begin to develop a training plan by conducting an assessment of your current levels of service. Ask yourself, how well are we meeting our own standards for service excellence? Look at the results of recent patient satisfaction surveys. Examine reports about incidents that may have impacted patient service. Make your own observations of cleanliness in each department and listen to conversations between staff and patients. Are you noticing any pattern that might cause patients and visitors to question your commitment to their best interests? If so, those observations might be clues about where to begin with your training program.
Develop training programs based on the gaps between your service standards and your observations about how well those standards are being met. Everyone in the organization should know and comply with basic service standards. Everyone should also know how to resolve service issues in real time as they arise. They should be able to recognize when patients or visitors are dissatisfied and be empowered to take initial steps to restore their satisfaction immediately.
Some departments may require further training in specific service skills. For example, clinical departments should understand how their service attitudes and behaviors could impact the quality of care. Those who greet patients in person and on the phone might also be trained in how to deal with belligerent people in a respectful way. Physicians may benefit from training in how their behavior toward nurses can impact their working relationship and the quality of care.
Look for ways to make the training experience interesting and memorable for adult learners. Adults need to be treated as equals rather than subordinates in the classroom. They prefer project-oriented learning experiences rather than simply listening to lectures. They also benefit from collaborative experiences so they can learn with others. Look for multiple methods to convey key concepts. Demonstrate those concepts with activities and affirm everyone's understanding with opportunities to feedback what they have learned. Use lectures, slides, videos, role-play exercises, and discussion questions to accomplish your learning objectives. Mix up the teaching methods to match the messages. Integrate an observational tour to help participants see the service standards in action and to recognize situations where the service standards can be improved.
Remember also that training is a never-ending process. Devote time to retraining everyone on staff every year to remind them of the basic expectations for excellent service, to build a collaborative culture of service excellence, even as staff members come and go, and to look for ways to constantly improve the service standards as the community changes.
Improving the service in a hospital, clinic, or other healthcare organization can provide several significant benefits. It can distinguish the organization from competitors. It can build patient loyalty. It can raise the morale of healthcare workers, and it can raise the quality of care. Improving service excellence begins by setting standards based on the best examples found throughout the community. It can grow through training and retraining everyone on staff, and by diligently working to improve services year after year.
Let's consider some common questions about improving service excellence. Everyone knows what is expected of them. So why do we have to train our staff how to serve people?
Different people may understand service standards quite differently. For example, does everyone have the same understanding of what a clean hallway should look like? How about a clean bathroom? And what about a friendly and respectful greeting? Training is essential to make sure everyone gains the same understanding of service standards within the organization. How they behave at home may be different than how they behave at work. Your job as a manager is to help them understand how everyone is expected to behave at work.
Healthcare organizations are unique. Why should we compare their service with other kinds of businesses?
We learn by example, and the examples of excellent service in one industry can impact the expectations of customers in other industries or patients in the healthcare organizations. As healthcare leaders, we should be among the leaders in service excellence in our community, since service can impact the quality of care. Everyone who comes to your healthcare organization expects to receive high quality of care. Therefore, your service should be at least as excellent as your medical competence. To apply what you have learned, we recommend that you discuss the following questions with your management team. What organizations in your community have the best reputations for service? How might their service standards shape expectations that patients and families will have for our healthcare organization? How can we help our staff recognize a service problem when it happens and resolve it quickly? This concludes Module 13 of 15. Thank you for participating.